A standard, dry cotton bandage offers zero defense against bacteria. Worse, as a wound heals, new tissue weaves directly into the dry cotton. When you remove the bandage, it rips away that delicate new growth, causing severe pain and resetting the healing process. To prevent this, clinical wound care relies on a multi-layered barrier system, using Para-tulle antiseptic gauze as the primary layer. Setting up this system requires a specific inventory: sterile saline, clean gloves, the Para-tulle dressing, a secondary absorbent gauze pad, and cohesive tape. By replacing a single dry bandage with this layered medical system, you remove the friction from dressing changes and build a highly controlled environment that actively supports tissue repair. Step 1 begins before you even open the package. Para-tulle must be stored in a cool, dry place, below 25 degrees Celsius, completely out of direct sunlight. The dressing relies on a medicated paraffin wax coating to function. Excessive heat will melt and degrade this core mechanism. With clean gloves on, begin your physical site preparation. Gently irrigate the wound bed using sterile saline to clear away loose debris. Next, take a clean gauze pad and pat the intact skin immediately surrounding the wound until it is entirely dry. Deliberately leave the wound bed itself moist. That pristine, dry perimeter guarantees your medical tape will adhere securely at the end of the protocol, without stripping necessary moisture from the actual injury. Open the Cotton Craft Pvt packet using the aseptic banana peel technique, pulling the tabs down in a way to prevent introducing any external pathogens to the sterile gauze inside. This primary layer is embedded with a specific active chemical agent, Chlorhexidine Acetate. This is a broad-spectrum antimicrobial agent. On contact, it actively neutralizes a wide variety of gram-positive and gram-negative bacteria that attempt to colonize the wound. Extract the tool from its protective backing pinkers and lay it flat so that it completely covers the entire wound bed. Because the gauze is heavily coated in paraffin wax, it is completely non-adherent. The chlorhexidine acts as a chemical shield against infection, while the paraffin provides a mechanical barrier that prevents the raw tissue from fusing to the fabric. Covered wounds naturally produce fluid called exudate. If that fluid is allowed to pool against the skin, it causes maceration, a rapid, destructive breakdown of otherwise healthy tissue. Looking at this extreme macro photograph of the Para-tulle, you can see the structural countermeasure to maceration. The gauze is engineered with a grid-like open weave pattern. To utilize this structure, you must place a dry, highly absorbent secondary gauze pad directly on top of the Para-tulle. In this 3D cross-section, the physics of fluid transfer become clear. The open weave allows excess fluid to escape the wound bed and lock into the absorbent secondary pad. Liquid passes right through, while the medicated paraffin remains firmly in place below. Finally, anchor the edges of the secondary gauze with medical tape or a cohesive wrap. Secure the perimeter, but do not wrap the limbs so tightly that you restrict blood circulation. This two-tier architecture keeps the wound bed moist enough for new skin cells to migrate across the surface, while actively draining the excess fluid that causes maceration. With the application complete, check the profile of the dressing. All edges should be sealed down, with no tight pressure points pressing into the skin. Beneath that secondary layer, a locked-in, moist environment is now continuously protected by Cotton Craft Pvt's chemical defense. The dressing should remain undisturbed until your physician advises a change, or until you can physically see fluid saturating the secondary absorbent pad. When it is time to change the dressing, the paraffin layer delivers its final benefit. It lifts away smoothly, ensuring a painless, trauma-free removal. Mastering this clinical application protocol does exactly what a dry bandage cannot. It actively engineers the fastest, safest, and least painful route to complete tissue recovery. Check the links below to access more clinical